I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks. I'm your host, Dr. Swannie Jett. Welcome to episode 2 with Miss Ashley. So let me ask this question, because I know we have to expand.
Right. You can say we, because I'll make an announcement here that Dr. Swannie Jett has graciously agreed to come in as our incoming board president for the American Heart Association starting in July. So we're very excited. So when you say we I hope that's okay.
That's fine. Thank you.
We're really excited.
Thank you for having me.
Yeah.
I'm honored because I got to go to work, make the donuts.
Wear just one more hat.
I got to go make the donuts. But I'm thinking, it should be, we probably have to figure out a way, how can we expand CPR programming? Because it seems like that's at the crux.
Yeah.
What ideas, you might have, because it seems like we need to do a lot to train our youth, but also train adults.
Yeah.
Because I'm amazed, I have to do it for the military. So and I'm BLS trained too, so every few years, but even then, I still think if something was to happen, I got to jump in.
Right.
And you need a refresher. So it's maybe every year you need a refresher.
So I'll say a couple of things about that. You mentioned the education and the training, and that is evolved, right? And so there is that full certification that is required by, first responders, certain folks that have to have that in their fields. But the Heart Association has come out, we're a science-based organization. We have come out within the past, I'm going to say around 3 to 5 years to say, compressions are better than nothing, right? So we have this idea of hands-only CPR. You could literally learn it in 3 to 5 minutes. And that's where we start, right? As a lay person with not having a medical degree or background, I am very comfortable, as is my team, as are so many trained folks in the community, whether it's the full certification or not. Press hard and fast on the chest, call 911, identify the AED. So there are just a few steps, and that's really what these resources that we have that we are sharing with our partners.
So that's almost like we're avoiding mouth-to-mouth resuscitation.
If you are intimidated by it, if you don't know the proper amount or protocol, then yes, we would say.
Maybe if you think the person has an infectious disease, because I don't hear anybody talking about mouthpieces anymore.
I don't either.
Because at one point people were so afraid
carry
to
them.
Right, carry a mouthpiece with you.
Yeah.
That just died off, right?
With COVID, probably, yeah. That's my guess. Yeah. So that's one piece of it, because you asked the question, like, how do we expand it, right? And so that's our job too, to work with our community partners and ensure we're moving further, faster, and managing the data. Like, I know you're a data guy, so like, how do we even share and express where we are versus where we're going in terms of those trained, whether it's hands-only CPR, whether it is full certification. Those numbers are easy enough to pull. But to your point, there's youth, there's adults, and then there's senior population. There's so many ways to look at it. And you mentioned life expectancy, and you think about the zip code correlation, because that in itself is a differentiation. You could go across town, across zip code lines, and find that there's a variation in life expectancy. And then, you can peel all of that back, and it gets overwhelming, because how do you boil the ocean? Because that's one aspect of helping a healthy community, is to teach them, hands-only CPR. But how about healthy eating? How about, knowing your numbers and when you should go in and see a physician? I mean, there's so many different places to focus. It goes back to maybe knowing your audience and knowing, being in a place where you're a trusted resource. And that's a whole different conversation about being in a place where you're going to have receptive audience that really is going to take just a piece away of what you have to share as a health organization.
And so probably knowing the highest rates of cardiovascular disease is in the West End. And I know we shared the same space in hosting a CPR class. So maybe that might be the initial
Right.
phase, is to make sure we host more CPR
Yes.
classes for elementary schools and adults
Yes.
and up. And so I'm willing to collaborate to make that part happen,
We would love that.
because that's a big part. And then we have to figure out, how do we serve the rest of the community. So it might
Yep.
need some more partners,
Yeah.
because you got to have people to come in and provide the classes and willing to do it.
Yes. And that's it. We have to have folks like you and other community partners that are willing to help make further connections, diversify our relationships in the community to go further faster. The other thing I would say is public opportunities and platforms to hold said trainings. You know, one of my dreams, I may have said it on the last time I was here, is to identify a funder who can help us have a training module, a machine that could be
Oh, that would be
in
great.
the airport, at the science center, somewhere. They actually rotate where we can bring them to different locations, but it is a training module on hands-only CPR. And I think about, you know, the legacy that would leave,
That
you know,
would
the
be huge
sustainability and the you know, foot traffic of people who come through the airport or are in our downtown or wherever that would make sense to the funder, but
Yeah,
another
because
great
right
idea.
now that device is probably 200,000.
Yep, it's right around that ballpark figure to keep it maintenance and to make sure that, you know, we've got the appropriate cleaning supply. There's a lot
There's
to
a
it,
lot involved.
but we're prepared and ready. And really, where we are with that is identifying a funder who
And
would help us.
probably even if you don't have an opportunity to practice, maybe if we could have videos
Yeah.
displayed in the airport to actually show how
Yes.
to. So, because a lot of people spend time in the airport, at least an hour.
Yeah.
So that's a lot of foot traffic.
It's a lot of foot traffic. It is easy to pull the aggregate data from that. There's actually a video module, that a screen that has that very quick, you know,
Right.
training, and then you actually get to put it into play. And we have stories from across the country of youth, you know, adults, elderly that have been trained on that have saved a life. It is an actual like life-saving opportunity.
So that gives me another idea while we talk to you. So, is it plausible that we can have those videos in different businesses if they would be willing to
Yeah.
use this? So,
Yeah.
so I hope the audience heard that you can
Yeah.
call American Heart Association
Yes.
and say, I'm willing to do that.
Absolutely.
Because that would be great.
Easy. It's easy to do. It is. And you think about employees' health and wellness, and a lot, you know, I'm hopeful that a lot of employers have that ability to help share those resources internally and then taking it out to family members. And I mean, that's the first right step.
So I'm curious, because we have just celebrated the 100-year anniversary of American Heart Association with this ball. So, and you had 800 people there. So
Yeah.
what's the goal for next year?
Whew, well,
I mean, because I don't know how you gonna replicate.
I know, right? Well, we can thank Witten and
I mean,
the
I
team
wouldn't know
for-
because it was my first year.
Well,
so.
first of many, I hope. So, but yeah, I mean, that's kind of where we are. And we do a lot of things throughout the year to celebrate. So we have a couple more things coming up, you know, in terms of our Go Red experience, which is formerly known as the Go Red for Women Luncheon. But we kind of tweaked the name on that. That'll happen.
Because I'm going to show up.
You be there, and you're going to have to wear red now. You too set the bar, so you can't go back.
Yeah, you're probably
Right?
right. I did the walk before, so because Omega Psi sponsors, we always in the walk. So I'm going to be there.
Good.
The Go Red Luncheon. So have you changed the name?
So Go Red Experience is what we're calling it.
Okay.
Go Red. But we're inclusive, right? So when we said for women, yes, we're focusing on education, awareness of heart disease and stroke in women, but everybody has a woman in their lives, but that should not be just solely focused on women. And so,
Yeah, because the highest rates of CVD is in African American men.
That's
unfortunately.
right.
So, yeah.
right.
So I'll be present. So 1,000 next year?
Yeah, I mean, there's so many goals and metrics, so I got to be careful because, you know, Whitney will watch this, and I want her buy-in.
I'm going to put it out there that
Put it
I
out,
want to
okay.
see
Put it out there.
1,000 people, and we want to raise 200,000. So I'm going to raise the bar up a little bit, right? Because I know we need AEDs in airports a
That's
lot
right.
more. So.
Right. And we will. And so we'll look at it from like the number of attendees. We'll look at it from dollars raised in the room. We'll look at it from, you know, a goal to raise in the auction and the open your heart moment. And we do that. And And I am proud to say we've continued to have our best year ever, increasing our gross and net proceeds year over year. So we won't be going backwards. I can
Right.
promise you that, Dr. Jett.
Right.
And we do not have a chair in place at this very moment in time. We have some thoughts about who will lead the gala. I'm not looking at you for that right now. Don't you worry. We have other very important business to do. But, those are things too, because the leadership of these celebratory events that we have that raise the dollars. I mean, it is important to have leaders in place that can help bring others into the fold that will help support it. So, we'll have our Go Red luncheon on the 24th of May, 2024. And then we'll move into our most grassroots focused event, which is the walk in September. And then we are just full throttle. We continue to have these opportunities that are, people decide they come to all of them or they can come to one of them, but there are no shortage of ways to be involved.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. I have, a burning question because we haven't broached this subject before.
Okay.
Right.
Okay.
So we on CEO Live Talk, so it's all about great leadership. Right. So I'm curious about your leadership style.
Okay. Very general question.
Yeah, pretty general. You have swag, so.
Well, thank you.
Right.
I didn't know that.
Your kids probably won't tell you that.
Yeah. They say things. They say things. That's not one of them.
But
It's
that's
not
not one
swag.
of us. That's swag.
Mama. Yeah, no. It's not one of the descriptive words they use. No,
Right.
but I am painfully self-aware. And I just believe that there's always, I'm a steward and a learner of the organization, right? I know I'm not perfect in any of my ways. I'm always looking at others and things that are working or not working. And so I'm certainly not a micromanager by nature. I'm very trusting. And I would say that I lead with positive intent on my team. And you've got to be really versatile. And it's just like raising kids. Like every day is different. And, you get comfortable with the uncomfortable and things are just going to happen. And so in a nonprofit environment, I lead by, being as flexible as I can and pivoting on a dime because that's just the nature of what we do. I believe you have to have a lot of emotional intelligence to be able to be in an organization and work with different people who have different personalities.
Did you say emotional intelligence? Shouldn't you give a test for that?
Yeah.
How you screen people before they come, right?
Yeah. And that, I just think it overflows into personal and professional life. But I don't know. I think that's how I would describe myself as a leader.
Would you, and I've heard people have different hats from home to work.
Yeah.
And so, do you switch?
Yeah.
Are you the same person?
You're asking me, or are you asking my kids, or my husband, or my ex-husband? I mean, you probably get a different answer from everyone.
Is that right?
No, I don't necessarily believe you can just cut it off and be one person.
But I've known people to do that.
Yeah, no, I have mad respect for people who are able to leave their work at work and come home and be. But in the field that I am in, and in the ability, I am very grateful to work for an organization that allows me the flexibility to be where I need to be when I need to be there. I also lead in that way, like you do. You work hard, play hard, or you get the job done. And we're not going to have any of those crucial conversations. But I mean, A lot of our board members and leaders or volunteers know my kids probably just as well as they know me. And if I'm on a Zoom call, like you may see a child, a cat, a dog, just kind of pop in and out. And I just feel like if you are your genuine, authentic self, you're never necessarily going to be judged by that. I mean, we're talking appropriate settings and nothing crazy, but if it's a 5:45, 7 p.m. call I've got to take with board president, board chair, or volunteer, I'm going to take it, and I might just say, like, apologize for the background noise.
But you caught me in a setting where my kids are
That's
around.
right. That's right. And I'm happy to have that conversation, and I want my kids to see me working and being successful and understand how that works. But they may choose to live a life where they can cut it off and do things separately.
Right.
I just choose not to. It just works better for me.
No, it's good to be your authentic self. And you said something, and I'm sure when you got to have a crucial conversation, it's very stern, very unpleasant. How do you have that conversation?
All right,
I mean, it seems like you're a master at it, so
You're
I can kind of tell.
Well, I fake it till I make it, I guess. I despise conflict. I hate conflict. I really am not the type of person. But if I get to a point in which I've pushed over my limit in a sense, but I do believe having behind closed doors those type of conversations and never putting someone on blast in a situation unless it's forced into that.
Right.
But I do feel like clearness is kindness.
Okay.
I would say my team might say differently, but it's rare occasion. But I'd try to foster that environment where all ships rise and everybody's understands the objective up front, right? So there's not a whole lot of questions. I love proactivity and ask the questions versus get your hands smacked
So
on the back.
did you start off that way, or did you develop that over time?
Yeah, I think I developed that over time for sure. I mean, I've sat in a lot of different roles within the organization, and I've had a lot of great mentors and leaders internally within the organization, but also board members, friends, people that have become friends, and having that guidance is helpful.
Did you learn from bad leaders?
Yeah.
That's probably the best lesson, right?
Man.
If you see.
Yeah. And
It's not the mentors.
That's right. You're not wrong. I mean, there have been situations I'm like, I definitely don't want to do that, or I never want to live that part of my life again in terms of business and work. And yeah, you're right. It works both ways.
I just thought I would ask the question. Sometimes people think, I had great mentors. Well, I really didn't have a lot of mentors. But I had a lot of people that I learned from that were in key positions. And I said, I do not want to do that. Well, I do not want to be like that. And, right?
It totally works both ways. Yeah.
So how long do you figure it takes a person to become a leader if you're not born a leader?
Wow, that's a really good question. Because some people are born with that, like, natural leadership ability. But also, I mean, here's what I'll say to that is that in the development and nonprofit world, we say, if you make it and decide to stay for 3 years, then you're probably vested in the organization and you're there for the reasons and you want to be there long term. So, I mean, I really would say, a year in at least American Heart in terms of nonprofit and honing your craft, it's going to take you a year, right? Year 2, we always say, is much more fun because you know what's coming, right? And then by year 3, if you decide I can live this life of a fundraiser, then you're probably vested. And so I think at least 3 years to be able to figure out if the skill sets and what you are doing is what you want to do long term, then that's going to be your minimum, in my opinion.
Don't laugh at me. So I came from the government side of healthcare, which people think that government doesn't operate functionally and effectively, right? But we have so much bureaucracy and so many rules that you can't go left or right.
Yeah.
And then I go to the nonprofit side, and I'm like, where's their structure and rules? Did you kind of find that difficult? Because if you're a leader that likes structure, and then you find an organization that doesn't, you have to build it.
That's right. And I will say to that, so before I came to Heart, I was with a different nonprofit, smaller in scale. And I really felt there and that was my entry point into the nonprofit world. I didn't know what I didn't know, right? And so I didn't have government or corporate structure really to compare in my career trajectory. So when I started a nonprofit, and I was just like, I hit this cap after 3 years and thought, like, I feel I want to explore more and other options. When I found American Heart, I will tell you, in my experience, there is structure, more structure at Heart than I would say in I can say
Because
in other
it's a larger
nonprofits.
organization, and
Yeah, and people thrive off of it or they don't, and it's personal preference and who you are. But I have thrived off of the freedom within that framework at this organization, and being able to be creative, and you got to live in the gray and you got to figure out. But I can understand from what I hear you saying and others that even corporate government, like it's very different. But I do appreciate the structure because it does. We always say there's no shortage of training and onboarding,
Correct.
ways that you can make an impact. But there's enough guidance to feel like you're supported. Sometimes it's overboard,
Right.
but in the same sense, it
that's
is
good.
nice. Yeah.
Hello, I'm Dr. Swannie Jett, CEO for Park Duval Community Health Centers. We conduct WIC, nutrition, and open enrollment for healthcare. So this is a one-stop shop facility for everybody in the community.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. So, you've been in the game 14, 15 years, but you've been at the top for the last 5. What would you tell yourself if you was starting out now?
Run. No, I'm kidding.
And what would you tell, the youth? Because, I have a lot of youth that watch
Yeah.
now. How to be successful, how to break into the field. So that's a
Yeah.
two-pronged question.
No, and I love that question because I think a lot about, myself and my trajectory, what would I have done differently as getting into the field. I firmly believe, and I'm in my 40s now, looking back, I think every experience shapes you and molds you to put you where you should be, right? Like and that has come into my mind in probably the past five or so years to think like, wow, all of those things I didn't know what it was leading me to, and now here I am. But I would say one thing I would have done differently, is taken my college internship opportunities more seriously. I would have leaned in. I did fine in high school.
You was a hard charger, so.
What's that?
You was a hard charger, so.
Yeah.
I don't know if you could have fit anything else in your schedule.
Right, true, and I did all the things, but I would have focused more. I would have ruled things out. I would have leaned into things and really taken my future more seriously in terms of what I wanted to do. I mean, I had fun in college. I had fun in high school, but I would have done that a little bit differently. I would have branched out into more different internships because You don't have to love it. Take it, move on from it.
Right.
And now there are all of these opportunities. Like we, from an AHA lens, we're doing paid internships. We weren't doing that pre-COVID. There are opportunities out there to get your foot in the door, and that's it, getting the edge, right? And I didn't do that. But to be able to connect and meet people, have conversations, you learn a lot of those skill sets. And what I'd also learned is that people are willing in their leadership roles to be able to mentor. And so whether the organization you work for supports that or not, there's ways to get involved, you know? But that's what I would say is don't turn a blind eye. Yes, living for the moment and all the things. That's how I felt back when I was younger, but putting more of a focus on the future because it will help you tremendously. And so I would say that's, just talking to people.
Okay. And that's what you would tell your younger self.
Yeah, and others.
And you have young kids, so what would you tell your kids? They come into you, they 18, 19 years old, and they want to be you.
Oh, that's a sweet thought.
It's possible. I had one such kid.
Yeah.
I don't know if she want to do what I did do now, but
Yeah.
at least she thought about it.
Thought about it. Yeah. I would tell them to explore their options, and that's not me, pushing one way or another. And that's one thing I'm learning right now with my kids being at the ages they are, 9 and 8, basically. And I want them to develop into who they are and find their passions. And if that happens to be in the nonprofit sector, working in philanthropy, that's great. But not to discount opportunities. I think I try really hard to explain what I do and how it makes a difference, but I'm very cognizant of, their father is saving lives every day on the street, and he's in police, and so he's got that focus, and that's very important. And I want them to know that everything that they do is very important,
Right.
And to figure that out for themselves. So building their confidence, ensuring that they have a good sense of self is really important.
That's very important.
Now, when they're 18, gaining life experience, being able to do things maybe I wasn't afforded or was able to do. Yeah.
And you definitely have a passion. And so I think you reverting back to teaching your kids that you'll be more successful if you have a passion
Yeah.
for what you do. But also, I have picked up the reason people follow you is because you have a passion for the job. So
Yeah.
despite if you have flaws or they don't like certain things about the leadership style, people know you're there for the realm of American Heart Association.
Yeah.
Like I tell people all the time, I am present for the realm of Park Duval. So I have no self-interest. So I can
Right.
go to sleep at night because there's no motive. It's for Park Duval. And I will walk away in whatever time frame it is God
Right.
said it's done
Right.
and feel like, hey, I've done what I can do.
Yeah, that's a great way to look at it. It
So-
really is. It's right. Like that's, yeah.
Well, this has been such an insightful show. So thank you for tuning in. Have a great rest of the weekend, and thank you for coming
Thank
to the
you for
show.
having me again.
Thank
I
you.
appreciate it.